And so at the lab, a core part of what we're trying to do is build these linkages between academic research, policy research, and public engagement as a way to build new knowledge, as a build to generate new empirical evidence, as well as contribute to growing our capacities to be able to navigate the complex changes that we see. One of the initiatives that we have at the Digital Futures Lab is called the Responsible Tech Initiative. And with the Responsible Tech Initiative, we're trying to identify the values and the frameworks and capacities that are needed to create a more responsible technology ecosystem in India. Sorry, I will be a little bit louder. Thanks for that, Tara. I think one of the things that we see in the context of the Indian landscape and rapidly evolving technological landscape is that often we're trying to address harms as and when they happen. So we're trying to address harms as kind of downstream harms. When they happen, we're trying to find regulatory fixes or other fixes that might address them. But often that creates a situation where we're almost trying to plug a leaky dam or plug holes in a leaky dam, and you fix one and you have to jump to the other. So with the Responsible Tech Initiative, what we're trying to do is think a little bit more upstream. What are the anticipatory interventions we need to make to be able to create a more responsible technology ecosystem? What are the kind of values that we need or we believe should be guiding innovation trajectories? What are the kind of social capacities? What are the kinds of institutional capacities that we need to be able to navigate these changes and to be able to align essentially innovation trajectories with social justice and with human rights in the Indian context? So our work with under the Responsible Tech Initiative, we look at issues around AI, we look at issues around big tech, and we look at issues around public tech. These three work streams are obviously intersecting work streams, and there's a number of overlaps within those. And a core part of what we're trying to do with the Responsible Tech Initiative is really foster a broader societal dialogue on some of these conversations. So the Tech and Society dialogues, which I'm so delighted that you all have joined us for, is a part of that, to try and create a space, a monthly space where we can all come together and take a pause from the everyday work that we all get caught up with, whether you work in tech or you don't work in tech, and to think a little bit deeper about some of these issues. So we want the Tech and Society dialogues to be a platform for academics to be able to present their research, for practitioners to be able to present their experiences, so as to enable some of these insights to then start informing policy making better. Because currently what we see is that there is a significant gap between what is happening or the kind of research that we're producing in academic institutions, the experiences of practitioners on the ground, and policy conversations. So I'm really, really delighted that we've been running the Tech and Society dialogues for about 6-8 months, but we had to take a pause earlier this year for a number of reasons. So I'm really delighted that we're restarting the Tech and Society dialogues, and that we're restarting it with this particular topic, looking at the issue of disability and access to public health services, an issue that is extremely critical, but that is not quite center stage in mainstream tech policy conversations, but one that is essential if we're going to build a more responsible tech ecosystem. So with that, just a huge thank you to all of you for taking out time out of your busy schedules and joining us, and especially to the speakers who we're going to be hearing from very shortly. So thank you, Tony, Gesu, Smitha, and Srinidhi for taking time to join us. I'm going to quickly introduce the speakers, and then I'm going to hand over to my colleague Arjita, who's going to be moderating the discussion today. So our first speaker for today is Tony. Tony is a PhD candidate in the Humanities and Social Science Department at IIT Bombay. He's a former Fulbright Fellow at the University of Massachusetts in Amherst, and he's a disability rights activist and has authored various articles on the accessibility of technology and disability policy. He also helps organizations and institutions of higher education make their policies and programs accessible for people with disabilities. We also have with us today Gesu. Gesu is a researcher with her interest lying at the intersection of human-computer interaction, assistive technologies, and artificial intelligence. She's currently doing a PhD at Swansea University, and her work explores disability-first approaches to engage the blind and visually impaired communities in India and Africa for building efficient teachable object recognizers. Prior to this, she spent 3 years at Microsoft Research, designing an accessible, play-oriented, computational thinking curriculum for schools for the blind in India, and developing a smartphone application called V-Stroll that promotes physical fitness among blind and visually impaired people by enabling them to virtually explore real-world locations of their choice. We also have with us today Smitha, who's a cross-disability rights advocate in India and a member of the Multiple Sclerosis Society of India, the Chennai chapter, and has worked for the advancement of human rights of people with all disabilities for the past 18 years. She's currently an accessibility consultant for the Election Commission of India, and she advocates forming rights-based policies and programs for people with disabilities, facilitates free legal aid to people with disabilities, and partners with government to design accessible solutions for all. And last but certainly not least, we have today with us Srinidhi, who is the co-lead of a program at Rising Flame, who is a disabled feminist, writer, researcher, and educator working at the intersection of sexuality, gender, disability, and technology. Her work focuses on deepening conversations around sexuality, understanding how technology and accessibility intersect, and building more spaces where disabled people can thrive. She has conducted trainings, undertaken research, and built programs on sexuality, leadership, digital access, security and usage, violence against women with disabilities, sexual and reproductive health, and media representation of children and disabled people. So thank you so much, Srinidhi, Smitha, Gesu, and Tony for joining us. Just reading out your bios, I'm just reminded on how privileged we are to be able to have you share your experiences and insights with us. And I hope this can be a longer engagement for Digital Futures Lab, and that this is an issue we can engage with more systematically and in a more sustained fashion, and that this is not just a one-off kind of event for us. I'm going to hand over now to my colleague Arjita, but I do want to just quickly apologize before I do that. I have an immediate family member who's currently not keeping too well, and so my schedule is a bit fluid, so I might be in and out of this call, but I'm hoping to catch most of it. And Sasha, it might be an idea to also post people's bios in the chat, and maybe Tony, Gesu, Smitha, Srinidhi, you'd like to also post your email addresses, etc., so people can contact you after this event. And we really hope that these tech and society dialogues can become a way for all of us to foster a kind of broader community and break out of some of the silos in which we typically find ourselves, or unfortunately often find ourselves working. So thanks very much, and over to you, Arjita.
Thanks a lot, Urvashi. Thank you, everyone, Srinidhi, Tony, Gesu, and Smitha for being with us today. As Urvashi already mentioned, that Digital Futures Lab's Responsible Tech Initiative strives to produce evidence-based research and foresight to align innovation trajectories with social justice. A core area of our research under this initiative is public service delivery and of public tech. So post the COVID pandemic, we know that the pandemic necessitated a greater need and a reliance on technology, which has obviously trickled down to everyday lives of people. And there's increased technology interactions with the state for businesses, personal use. And in that context, it is imperative that the access is meaningful to these emerging technologies. But in that context, we also found out that a lot of the digital healthcare technologies that the government had adopted last year were largely inaccessible to a lot of disabled people. So Arogya Setu, which was launched with the goal to connect healthcare services to people, it was largely inaccessible to visually impaired folks who were using screen readers on their devices. And in addition, the CoWIN website was also incompatible with screen readers. In this context, we would like today, for this discussion today, to be around these inaccessibilities, but also explore the other plethora of inaccessibilities that go beyond the use of screen readers that persons with disabilities would face while using healthcare communication services, mobile health apps, telemedicine, etc., and really look at the impact that these inaccessibilities would have on the lives of people with disabilities, especially when it comes to healthcare and access to it. And also finally look at the gaps between the disability rights activists, grassroots organizations, disabled persons organizations, and government policy, GovTech, and how that gap can be bridged. Is there a dissonance? How can the government engage meaningfully with disabled persons' leadership, expertise, and work to ensure that the access to these technologies is meaningful, inclusive, and how can these technologies then be designed better, keeping in mind the contexts of disabled people. With that, I would like to begin with Tony. Tony, can you hear us? Is your audio working?
Yeah, I can.
Sasha, can I request you to spotlight Tony, perhaps? Thank you, Tony. Thanks for joining us today. So Tony, my question to you is, during the first wave of the COVID-19 pandemic, when the government had pushed out these several healthcare communication services and mobile health apps that I just spoke about, most of them were criticized for being quite inaccessible. So could you tell us a little bit about how public health tech during the pandemic was experienced by persons with disabilities? What were the main challenges, and what was the scope, what was the scale and the nature of this exclusion?
Hi, thank you, Archita, and thank you, Digital Futures Lab, for having me here. Hi to everyone here and my co-panelists. Because I'm the first, like this is the first question was posed to me, let me begin by articulating two specific things. The first thing is that person with disability is not a monolithic category. Now, this is very important for us to keep in mind while talking about healthcare and access to digital health technology. Persons with disability is often thought as a monolithic category, both in policy and in academic discussions. But if you look at the community, there is a lot of variety and variations within the disability community. And even if you take one disability, one specific disability, I'm blind, and therefore I'll be largely talking from a blind and visually impaired perspective. But even if you take the community of blind individuals, you would see a lot of diversity within it. There is a huge amount of inequity on the lines of region, urban, rural. There's a lot of class inequality, gender inequity, and so on and so forth. It's like any other community. So while we can think and talk about persons with disability as a category, we should be extremely mindful about the fact that it's not a monolithic category itself. But what we're doing right now here is to tease out, for discussion's sake, that category called persons with disability, while being mindful of the fact that the category itself is not a monolithic one. The second thing I would like to point out is that so why does persons with disability and health matters? Other than the fact that disability itself poses certain challenges with regard to accessibility to healthcare, disabled people or persons with disability are also have also certain high health risks. Now, let me point that with a couple of examples before I respond to your specific question, Archita. And if you look at blind and visually impaired people, we have enough studies to prove that blind and visually impaired people experience high amount of insomnia or sleep-related disorders, right? There is a lot of studies we have by now to say that people with mobility impairments, mobility challenges, also have, high rates of heart ailments when compared to a non-disabled population. What is the implication of this? The implication is that not only that persons with disability have access challenges in accessing healthcare, persons with disability are also often experience higher health risk on account of their disability, and some of these health risks are not even related to primarily related to disability. Like, for example, why would someone with blindness have difficulty in sleeping? What does vision have to do with sleep? But then if you look at it closely, you would understand that circadian rhythm that is closely associated with light perception has a lot to do with your vision. And therefore, blindness has to do something with sleep disorders, right? Now to the specific question. So we are talking about a community which have accessibility challenges, but also have are at higher risk of diseases. We are talking about this community, and then in 2020, when the COVID pandemic came, the easiest solution for the government, and this is true to many of the bureaucratic exercise, that when there is a challenge, when there is an emergency, you go to the easiest method, you adopt the easiest method, and the easiest method adopted was online websites and apps and so on and so forth. There were a lot of accessibility challenges. I would elaborate on it as we go ahead, but for the time being, let me point to a couple of them. For example, a lot of the initial, so when the 2020 pandemic started, a lot of the information that was disseminated, and this was even before vaccines came and all of that, a lot of precautionary measures, a lot of diagrams and graphs that were related to the spread of COVID, and all of that, these were supremely inaccessible for blind and visually impaired people. Now it's okay. Generally, also you don't graphs and stuff like that are not explained in an accessible way. It's okay if blind people doesn't understand, how IPL scores and which team score in an IPL match or a English Premier League match, or such things. But COVID-19 information was very critical. It was important for us to know how the virus spreads. It was important for us to know what kind of precautions should be taken. But a lot of this information were disseminated in a visual friendly format. And unfortunately, the people who took care of this information were not mindful of the fact that screen readers' accessibility should be kept in mind. Now, after that, we had two very important initiatives from the government. One was the Arogya Setu and then the COVID portal. We will go to the accessibility glitches in these platforms in detail at a later time in a while. But the mobile app, for example, was inaccessible. The Arogya Setu app had a couple of serious accessibility glitches. So did the COVID web portal, which meant that people with blindness could not get vaccination, but also could not use the Arogya Setu app and understand has anyone in their proximity got virus or not. So there was one level of accessibility issue was at the vaccination level, and the other set of accessibility issue was at the level of social distancing, what can be called as what can be thought of as whether the virus is spreading or not. This kind of and then the information accessibility challenges with regard to the information, because, like I said, a lot of information was presented in visual format. Yeah, actually, I hope I respond.
Chitra, you're muted. You're muted.
Thank you so much. Thanks so much for pointing that out. Thank you so much, Tony. Thank you for highlighting that the disabled community is not a monolith, and there were various levels of accessibilities based on the various identities that persons with disabilities live in. I want to take that tangent and come to Srinidhi. Srinidhi, thanks for being with us today. I just wanted to highlight the work done by Rising Plane. That's a very important report, neglected and forgotten, that has highlighted the issues that persons with disabilities face, issues not just with regards to digital accessibility, but since Tony has pointed out that the community is not a monolith, could you perhaps highlight how, in your experience, do you see the digital disability divide deepening further for disabled individuals who live with other identities, such as queer individuals or women in urban or rural areas?
Thank you so much for sharing, and I'll try not to repeat some of the points that our report showed, which overlapped with what Tony has already mentioned with regards to access, etc. I think primarily one of the big things that we saw in our during the research for neglected and forgotten, which was done, it is a research study that was done across India during right after the first wave. So it very much centered women with disabilities experiences of COVID-19 as the pandemic. And one of the things that we saw was it is a report that catalogs cross disability experiences. So there are people across 9 impairment groups who participated in it, and mostly the identity was self-identifying as disabled. So one of the things that we noticed in a lot of that was what Tony flagged as well, was about access to information in general. And one of the things that women, and both from rural and urban locations, one of the things they told us was that because information was not categorically created or catered to people with disabilities or women with disabilities, a lot of the information that they were receiving was vis-a-vis some member of the family. So one of the key experiences that deaf women told us about was that since there was no sign language interpretation when the lockdown was announced, or when some of the information around COVID itself began to spread, there was a lot of it was TV news, which is heavily TV or radio, which is heavily used, let's say, in large part of Indian households, which might not have access to mobile phone technologies or the internet. So a lot of these, in a lot of these locations, the information came as it came via a family member or a friend. So it was reduced to the gist of it, which was around the idea that you will die if you go out. Right. So one of the problems with having inaccessible information is that who is providing this information to women with disabilities, and what impact does that information have on women with disabilities in understanding their mobility, in their agency of choice, etc. So the connections between inaccessible information and its impacts on other aspects of disabled women's lives was very clearly seen in our report, in the research that we did. We also did, and for a lot of women, we also did another research during the second wave in India. And one of the things that we found during that research, which was a quick survey, which was done among among people with disabilities in general and not just around women, that a lot of the distress was around not being able to access very specific healthcare that was not catered for women, not catered for people with disabilities, because of the priority given to COVID and COVID support, etc., from healthcare services across the country. So a lot of people, especially women with locomotor disabilities and other deteriorating conditions, did flag that they did not have access to physiotherapy, which was heavily missing because it's hard to do it via teleconsultations, and telemedicine in general not being helpful in that sense. Other cases where we heard about digital health being not helpful or not easily accessible was around sexual and reproductive health care that women with disabilities needed to access. And what that meant in terms of having to do it on a computer or a phone, which often is not something that we see women with disabilities have. That is, the digital divide between men and women, as we know in the country, is very high, but it is also really high between men with disabilities and women with disabilities. So there was a lot of concern around not having devices and needing to use the devices that were available at home to communicate with the doctor. Many of the women with disabilities did flag with us that there was no concept of privacy for them because a lot of them lived in small households, etc. So a prior engagement around digital health where women with disabilities could go to the doctor and talk about concerns that were present for them. suddenly were missing for them because of the fact that there was no private space to communicate with the doctor, especially around sexual and reproductive health and rights. And that sometimes also needing tests to be done or being physically present in these situations. So a lot of these aspects did determine how, even if there were telemedicine and telehealth accessible and available, which many of them said were not always screen reader accessible, but there were other access barriers that came into being because of the fact that there was gender at play, or because of the fact that there was because they were from locations which did not have internet accessibility in general. So a lot of rural India and having access, or other implications of poor access to devices in general, which meant that their own agency was not necessarily, they did not have space to exercise their own agency. Yeah, and one of the things that a lot of the women did flag around this was the fact that that this was the mobility situation in connection to lack of information was something that was very gendered at play, because of there is nobody to take you out and go, so they would not go. And this would mean that if somebody had to access their disability pension and needed to travel to an ATM to access it, because mobility was so fractured, there was other implications of not having access to their pension, which would give them access to healthcare facilities, etc., if need be, private healthcare facilities, etc. So the connections between what we understand as everyday living, and how, where the digital ends and the offline begins, is very hard to determine, and that becomes more complicated with regards to accessing everyday care and facilities. And like Tony mentioned, the vaccinations and in general were the portals itself were inaccessible. And one of the things that we heard from other people was that the usage of CAPTCHA in these portals also made it hard for people who needed to, slow for people even with locomotor disabilities who need to move towards their the area of the phone where you get the SMS for the OTP and typing it in back, and that delay was also something that would lapse their ability to book a vaccination slot. So these kinds of intersecting problems of accessing information regarding healthcare and what that means with regards to everyday functioning was reported across the groups that we spoke to.
Thank you, Srinidhi. I think that's a very interesting point that you raised, that the distress came not just from not being able to access healthcare communication because it was inaccessible, but also that a large amount, the priority was generally given to communication and information dissemination around COVID and COVID issues. With that, I would like to go to Smitha. Smitha, as Urvashi had announced, you had worked with the Election Commission of India as an accessibility consultant. I was wondering, what impact did you see that this lack of access have on the lives of persons with disabilities? And how do you think that the introduction of technology and apps to deliver public services has shaped issues around access? And do you think there are other factors beyond access that are important when designing technology to aid the delivery of public services?
Yeah, hope I'm audible.
Yes, you are.
Yeah, with regard to accessibility, because of barriers, people with disabilities basically face discrimination. They are, they are literally discriminated, and the result is inequality, incapacity, and poverty, and ineffective or literally nil, participation. And so when all these discriminatory aspects are happening because of inaccessibility, there is a kind of attitude in the society associating all these inequalities to the disability. Whereas it is, people should understand that it is the lack of accessibility which is causing all these issues. And accessibility is an enabler not only for persons with disabilities, but for all. If we look at ramp as a point of access for wheelchair users, then stairs are also a means of access for people without disabilities. Similarly, if a tactile guiding path guides persons with visual impairment, then stairs or a pathway guides a person without disability. So accessibility is a requirement for all, and in that way we have to approach that. And with regard to technology itself is a means for easy access, whereas when we face barriers in technology, then the issues become multifold. And with regard to the elections, persons with disabilities had a lot of issues in participating equally in the electoral process. And when the PWD app was introduced, things were made much simpler. And what we saw is like more people were part of the electoral process, and there were issues. Yes, as you said, as Tony mentioned, and as Srinidhi mentioned, there were issues in technology. And when we highlighted the issues to the Election Commission, then the issues were kind of sorted out. And then people started using it. And again, the issue is like the technology gets updated often. Constantly it is getting updated, whereas the accessible formats are not really getting updated in proportion to the it doesn't match with the technological updates. So one should be conscious about it, and only then we can ensure accessibility in technology. So this is a glitch which we are facing. And even when I was working in the 2016 elections with the Chief Electoral Officer of Tamil Nadu, we, the Disability Rights Alliance, made the website of Tamil Nadu Chief Electoral Officer accessible for persons with disabilities, for persons with visual impairment and print disabilities. Whereas what has happened is, after a few updates, the website again became accessible. And again, we have highlighted this issue with the CEO's office, and now the CEO's office IT division is trying to fix. So this is the glitch which we are facing with the technology. Technology is kind of accessible, and with Arogya Setu app also, it was not very accessible for persons with print disabilities, as Tony was pointing out. Not only for people with the visual impairment, it is not accessible for a lay person. Even I was finding very difficult to navigate Arogya Setu app, and after repeated trials, I just left it. And in such scenarios, what do we do? We should have plan B. In Tamil Nadu, the disability department has an accessible toll-free helpline, which was set up in with the demand from the disability sector. And there is a sign language interpreter who is part of the helpline, and we can do video calling with her, and people with hearing impairment and deaf persons interact with the sign language interpreter, and that is how the grievances or the issues or clarifications are sought. And with regard to the vaccination program, when Arogya Setu was not actually helping and we could not register through the Arogya Setu app, what was happening at that time is Madras High Court gave a verdict saying that vaccination program should be prioritized for people with disabilities. Whereas, is that enough? Is priority enough? Because accessibility is the ultimate need of a person with disability, and we highlighted that issue with the department, with both the disability department and the Chennai Corporation, and they supported us. And ideally, we came up with a doorstep vaccination program. And how did we register? We did not register through the Arogya Setu app. We registered through the toll-free helpline of the disability department. So when we did that, our names were registered, and our list was with the department, and the department approached us through in our phone numbers and came to our houses and vaccinated us as well as our caregivers. So this is some kind of collaboration which the disability sector did with the disability department and the Chennai Corporation. And similarly, as I told you, how we are working with the Election Commission of India. So for your last question, beyond the accessibility requirements, what is very, very crucial is the information should reach, the information should be made accessible for all persons with disabilities. There are facilities available, whereas is that enough? If people are not aware of the facility, how can we use it? So the information should reach people and should also be in accessible form so that they can understand it. And the next important thing is to engage with persons with disabilities and their organizations, so that we people with disabilities or the civil society groups know what is the need and how can it be addressed. So we know the need and we know the way forward, and when the government collaborates with us, we can really find solutions easily and address the issues in an effective way. Thank you.
Thank you very much, Smitha, and also thank you for highlighting regular criticism that the disability community has had with tech and tech builders, that even though regular updates are done to websites and applications, accessibility issues are not given as much priority. And even though they are made accessible to begin with, to updates too often kind of throws that accessibility out of the loop. So thank you very much for highlighting that. And with that, I would like to take this to Gesu. Gesu has worked on design of accessible play technologies, and which is why my question to Gesu is that in your experience with working with children with visual impairments and accessible play, how did this access to digital media and technologies affect learning and development, and what were the technologies that were used?
Am I audible?
Yeah.
Okay, thank you so much for having me, and thank you so much for the question. It's very interesting how, like listening to how COVID has impacted disability community. And when it comes to education, of course, the impact was there as well. And in my opinion, a bit more and worse compared to the non-disabled community. So to give a little bit of context of how children with vision impairments in India access education is that a majority of blind kids go to schools for the blind. These schools are exclusively for blind children, and they offer all kinds of courses like, your language courses, STEM and everything, along with computer classes. We started our collaboration with the schools 3 years back when I was at Microsoft. So me and my team, along with an NGO called Vision Empire, we started reaching out to the schools to understand the status quo of how the technology is being used right now, how much it is right now, and how is the entire environment of education over there, specifically with STEM, and how we can incorporate digital tech over there. But this kind of took a different turn when pandemic came. while we were doing the kind of investigation of how it was, we found that the schools had poor technical infrastructure. Like, for example, in an integrated school where kids of disabilities or no disability study, usually the computer classes are introduced to them from grade 1, and they have like a very structured curriculum of what is supposed to be taught. And by the time they graduate the schools, they have learned, the basic computer tasks like emailing and creating docs and stuff, along with some level of programming as well. So they are taught these concepts in a very structured way. But when it comes to schools for the blind, the curriculum they have with relate to the computers, it's very outdated. So it was shocking to us to find that, because we collaborated with schools in Bangalore, we found that on average, the children are introduced to computers in grade 5. So what a child with no disability, is studying, or even with disability, when a child studying in integrated school is learning something in grade 1, the same child in blind school is learning in grade 5. So there's always like a huge gap of digital literacy over here. And by the end of, when the child in the blind school graduates, what they learn is just the basic task along with the screen reader, and the accessible tech related to computer use. They learn emailing and the basic use of doc and everything. So there was this already existing gap. And on top of it, this was kind of like a result of other factors as well. Like, for example, the school had very few computers per children. So like children had to like share a computer, like 2-3 children would share a computer in general. The teachers, there was no as specific like a computer teacher. So one teacher would teach like multiple subjects. They were overburdened, and they also like lacked the exposure and literacy themselves to create a curriculum to match with the level that is supposed to be in the market, for the, the STEM kind of career opportunities and other like choices you would make for your, education beyond this. So there was already these kind of things. And when pandemic hit, it became like, so most of the children in blind school, they study there, they also live there. So these are also like residential schools. And while they are living there, they don't have access to phones as a child living at their house would have, like, with their parents and stuff. And majority of these kids also come from low income families. So when pandemic came, children had to go back to their homes. And imagine a scenario where, integrated school are going all online because, digital medium is the only medium during the pandemic. But for schools with the blind, it's very difficult right now because the teachers themselves are blind, majority of them, like 70% of them, and they as well have come from the same school system. So they lack the digital literacy that's supposed to be there. So they themselves are learning on their own how to take classes, which are supposed to be very hands-on when it comes to, vision impairment. So they're trying to like figure out how to take these classes online, even if it's audio or something. So they first began with using telephone access. So like creating like a group call, because most of the children who went back to the homes, they didn't even have a smartphone at their house. So it took a lot of time for them to figure out how to do things. So they initially started with a phone call group thingy, and everybody would come and join the group. But despite all of that, it almost took like a year for all children to come on board with the online classes. So in the end, what happened, that school, they are mostly run on government funds or like funds from private organizations, and children there study for free. And so they accumulated some funds for the children, and they sent a smartphone to each child at their home because they didn't have it initially. So the children can finally come and join, like things like WhatsApp and use Zoom and other things. And what happened with us, like we were doing this kind of like a separate collaboration where we are, getting and, going and interacting with children and, creating technologies. They are not really like technologies as they would seem like. They're just toys which just work on batteries and a bit of wires. So we're creating them and we're trying to figure out how to introduce it to children. And we were actually teaching them computational thinking through music and storytelling. So they didn't even know that they were learning programming. It was just music. But then this all came falling down because we don't even have basic infrastructure in place. And the schools, they don't even have internet, and we have to bring internet. They don't even have earphones. And when pandemic happened, everything changed. So it impacted the children specifically when it comes to education, blind children, a lot, and in various ways. And it's still like doing its part, I would say.
Thank you, Gesu. Thanks for highlighting that the inavailability of ICT infrastructure is something that's a huge problem with blind schools. That I think that's like forming the basis of the digital disability divide. I would like to talk about the actual design of the technologies a little bit now. So I'll go back to Tony, perhaps. Tony, can you hear us?
Yeah, I can. Sure.
Hi, Tony. So you had mentioned in your, when we were speaking earlier, that the design of the actual applications were largely inaccessible to screen readers, and not just inaccessible to screen readers, but there were also other kinds of inaccessibilities that were not spoken about. So could you elaborate on the specific design elements that you, in your experience, made apps inaccessible? And also, like, where do you think public tech and government tech is lacking in terms of accessible design?
Yeah, sure. So thank you again, Archita. And let me start by saying that technology is not the villain here. Let's not go home with the idea that if it was not for technology, it would be so good for person with disability. No, technology is not the villain, and technology is not the culprit. What is the culprit? The culprit is specific design elements that has to be incorporated into the technology, which were not incorporated. So it's not the technology, it's human inaction that is a culprit. So there are accessibility guidelines. If there are anyone here uninitiated, you can, there are guidelines called WCAG2 and WCAG 2.1 and so on and so forth. So there are these guidelines that exist, and all that the developers have to do is to follow these guidelines and insert these guidelines to the product, to the app, or to the website, or any digital artifact that one is creating. Having said that, let me now point to the specific design challenges we faced. Right now. Sometime in early May was when the vaccination was open to the people below 45, and someone below 45, I thought I should try and book a slot. And that's when I got into the COVID portal. The first challenge that came was the CAPTCHA. So again, CAPTCHA by itself is not a problem because there are alternate ways to do CAPTCHA for blind for screen reader users. It's called the audio CAPTCHA. Now, if you go to any websites such as Amazon or websites of that sort, you would find that there is a provision for an audio CAPTCHA, which was absent. The other challenge that I faced was the date picking thing. Now, again, calendars or calendar combo boxes are not the problem if they are designed in screen reader friendly ways, but unfortunately, COVID calendar was inaccessible, which meant that I still remember I was trying to book it for 12th of May, and it never would come to that. It would go to random dates, right? Which meant that date picking was not happening for a screen reader user. And that's when I flagged it via Twitter and to the government that have to do something about this, right? And then the app component. So more than often, and even I can still recollect the COVID-related apps from the government had a lot of unlabeled buttons. So what are unlabeled buttons? So let's say that you have a button that says something like home. So instead of labeling it as home, more than often, apps usually has a picture of a home, which the screen reader often doesn't recognize. So these are unlabeled kind of buttons, and there were a lot of them. And when a screen reader reads like unlabeled button 1, unlabeled button 2, and so on and so forth, me as a user get confused and finds it difficult to use. 2 quick points before I conclude. Was this problem exclusive to India? Not at all. There was a lot of surveys and studies conducted in 2021, and we realized that around 89% of apps and websites all over the world, which was specifically made for COVID, were not meeting accessibility standards. And the survey was done in around 200 countries. So around 89% of the of the apps or websites did not meet the prevailing accessibility standards. So some people did a global bug bounty program for accessibility, accessibility bug bounty programs. And you would not imagine this, but there were more than 350, if my memory serves me right, there were 368 bugs related to accessibility, which was spotted on Indian government's COVID-related websites and apps. Mind you, 368. That's a lot of them. So what I'm trying to say is that what I have highlighted here in the form of CAPTCHA and calendar and unlabeled buttons are few and far. I mean, there were many of them, and these 368 odd bugs made it, ensure that persons who are using screen reader did not get slots for vaccine booking. Another interesting thing, but I would like to point out. So I like the visual world. They always come up with like fascinating solutions. So we're like, okay, fine. There is the slots are not available. Let's make Telegram, things, Telegram channels or groups or whatever they call. So a sighted person can look at their mobile screen and then quickly book the slots. Someone with screen reader can't do that. So I was specifically telling my friends that when you're doing this, when you're into this, when you're doing this Telegram thing, kind of mode of getting the slots, that's not something that is not accessible. That was accessible per se. Screen reader users take a little more time to access that information. And by the time I access from my phone and come back and try and book it on the slot, provided that the COVID portal was active, been that the government followed the WCAG guidelines. The non-technical solution would have been to recognize that disability, persons with disability as a priority group. That was not done. When the government decided the priority group, it was persons with disability were unfortunately omitted. We have consistently maintained both in courts as well as in our petitions to government that the priority group should not be defined based on morbidity. It should be based on the vulnerability to COVID, and that definitely persons with disability should be included in that. That was not done, but somewhere in late May, there was a Supreme Court order that mandated the government to make all the websites and apps related to COVID accessible. And some of the actions, some actions were taken. We can, sometime at the conclusion meeting, we can have a quick chat about, what can we do to avoid such catastrophes. I won't have to call it a catastrophe. One has to call it a catastrophe. So we can perhaps have a quick chat about, what can we do to avoid such catastrophes in future. But like I said, the design challenges were quite a lot, and what I have highlighted here are a few. Thank you.
Thank you, Tony. And yeah, you're absolutely right that the window to book a slot for the vaccination was just so small that it posed major barriers to screen reader users. And also thanks for highlighting that this issue of inaccessible digital healthcare was not just peculiar to India, and there were other countries who were also complicit in inaccessible design. There was this research that was done by Center for Internet Society in 2012, where they audited about 7,800 websites, government websites, Indian government websites actually, for accessibility, and almost all of them were inaccessible. And even though it's about 10 years old, that study, not much has changed, despite, like you said, WCAG guidelines being in place and also the NCRPD being ratified by most countries. With that, I'd like to go to Srinidhi. Srinidhi, how can the public sector design with disability in mind? I know it's a very difficult question and a very big question to answer, but how can the government and the public sector design in order to make pertinent information accessible to all citizens and disabled people specifically?
Thank you so much for that question. I'll take off from something that Tony said. Really, I think it is the basic thing is to imagine that a disabled person will access this website, this content, this information, right? I think because we aren't seen as citizens, consumers, active users of digital tech, that often these aren't catered to us at all. So I think one of the big problems there becomes that when we don't imagine that this will be used by a disabled person, then we don't necessarily begin from creating it, imagining that a disabled person will access this information or this content. And I think one of the big problems there is also that because the community is large and diverse in nature, that access needs also differ from person to person and disability to disability. So I think our understanding of how to create information that would be accessible across disabilities is also not growing with time. I mean to say us as an outside of the community, because of the assumption, because of not enough interactions and actually seeing disabled people as experts in this, right? So there could have been many ways to ensure that the information produced by the government from, say, the early COVID-19 pandemic year, which is March 2020, to now where we are in May 2022, we could have seen it imbibe some of the things that we are talking about. Like over a period of time, it could have shifted and changed access to the information around COVID-19 and this thing. But I think because a lot of the information is also growing with time and is so diverse. Early on, we thought cloth masks were okay. Now we know that they are not. That it requires people to wear N95s, etc., or other protection. And this is public health messaging, right? That has changed over a period of time. But what happens if this messaging of this content is not accessible to disabled people of different groups, right? Like, are the videos being circulated? There are lots of information and videos on social media which are doctors speaking directly, asking you to mask up and talking about the importance of some of the public health measures. But none of those videos have subtitles. None of those videos have sign language interpretation. So we're completely leaving a group of deaf people unaware around the changing application, around the changing science around this, right? Then there is a lot of information that is shared as viral memes and infographics, etc., which are all not screen reader accessible. So I think the information also requires us to think about it from a cross-disability lens, right? And this is not new that disabled people are being left out of being provided crucial information, right? We know as this is historically true for blind, deaf, blind, and intellectually disabled people, that they are left out of information, access to information. And access to information means inability to keep ourselves safe. Inability to move around safely in this environment. And already blind and deaf-blind folks have a very tactile experience of the world, which is something that heightens their exposure to the virus. So I think some of these conversations around informational access to the changing information around COVID-19 is essential to be provided, but it requires us to think from a cross-disability lens instead of just thinking about a certain group of people who are trying to access, and that idea of who's accessing this information stays very much in urban, non-disabled, not queer lens, right? So it's a very narrow lens as we are perceiving who's consuming this information. I just wanted to close with one thought around the fact that even when we think about the vaccines and how we have catered to it, and Tony mentioned this briefly, is that there was no that we could have had alternatives to think about accessing information around this. And one of the things that we found with a lot of people who are immunocompromised, which is an overlap with a lot of disabled people, is that our doctors did not necessarily know about, or there was not enough public information around what vaccines we should take, or what is safe for us to do, what medicines are we supposed to go on, what medicines are we not supposed to go on. And this is, as somebody who has privilege and access to information online, I found it difficult to make this decision myself. But for people who don't have access to the internet or are not seeing this global discourse that is happening around COVID-19 and are disabled and immune compromised, where is that information going to be provided? Who's going to provide that information? Does the public health center have that information which is specifically for disabled people? No. So I think all of this, the idea of centering us in this conversation, is that we as a country need to be able to look at disabled people as vulnerable people in this pandemic, and then ensure that information, access to resources, everything is provided for this vulnerable group. And I think because we haven't really structured our understanding of the situation like that, we are really struggling to, as a community, disabled people are struggling to access this information in the same manner at the same time that non-disabled people are accessing this information.
Thank you, Srinidhi. Absolutely, like you said, since disabled people are not seen as consumers of tech, often the tech is not designed with disability in mind at all. Smitha, with that, I would also, Srinidhi highlighted how immunocompromised people were not given appropriate information in an accessible format. And Smitha, as a member of the Multiple Sclerosis Society of India and also a member of the Organization of Rare Diseases in India, how, in your experience, do you think governments could perhaps best engage with disabled people's work and expertise and leadership in order to bridge this divide between disabled persons' organizations, their experiences, and the top level policy and design? Smitha, you're muted, I think. One second, Smitha, let me perhaps. Can you unmute yourself?
Unmute. Okay. Am I audible now?
Yes, you are.
So I would like to echo Srinidhi. She brilliantly put it across. And, as she said, people with disabilities should be seen as consumers and as experts. Now, what the government is doing, they are looking at building up, human resource for people with disabilities, whereas the government should start looking at people with disabilities as human resource. And we are the experiential experts with our own disabilities. And as Srinidhi also pointed out, there are a variety of disabilities, and including the immunocompromised people. So everything should be taken into account, and not just certain accessibility formats. And so the government should definitely look into capacity building of persons with disabilities, and considering us as experiential experts. And with regard to the apps, basically, with the Election Commission's app, what we did is we started giving a small tutorial which helped a lot with the people. So the technological divide should be addressed with all these kind of small, short, accessible tutorials and other easy engagements. And then the next thing, what the government should be doing is to engage with persons with disabilities, with the organizations of persons with disabilities, and the community-based organizations or the support groups of persons with disabilities, so that they are part of planning as well as decision making. Right now, the government is also doing a divide and rule policy where the government is taking all the decision, and wherever people with disabilities are included, they are only included in certain aspects and not holistically. We can take, for example, the disaster management. So where are people with disabilities? How would the disaster management team rescue a person with disability? There are diverse disabilities, and there are people with disabilities having diverse needs, and not two people with the same disability are alike in their needs. So a comprehensive and holistic and human rights based knowledge of disability and the human rights approach and accessibility is a must for all departments, including especially the disaster management authority, because even the pandemic is a disaster. So we don't know when the disaster strikes. So we need to be prepared for that, and the government should take efforts on this line. And third is, as again Srinidhi mentioned, the availability and accessibility of information. For example, Tamil Nadu started with a great scheme of Makkalai Thedi Marthuvam, where medicines and the treatment will be provided at your own doorstep. Whereas this, only in the news, this information is coming that this particular scheme is launched. But if a person with disability wants to access this particular scheme, and how will I know who is coming to my house, and how do I validate or how do I verify that this particular person is only from this particular department or from this program, and what are the services provided to me at my doorstep, and in case the person, the healthcare worker doesn't turn up, who do I approach, and in case there is an emergency, how do I approach the system? So these kind of information are not available. That makes the programs a failure when compared, when considering the reach of persons with disabilities by these programs. So that needs to be looked into place. So my key key 3 points are like to consult and engage persons with disabilities, and to provide information, appropriate information in accessible formats, and to look at persons with disabilities as human resource. Thank you very much.
Thank you, Smitha. Thank you for also bringing up that despite there being appropriate measures in place to provide healthcare services to people, often information about these programs are disseminated in very inaccessible formats. Gesu, I'd like to move on to you, and this is the final question. So I would request everyone, if you have any questions for the panelists, you can leave it in the chat. We did circulate a registration form where we asked any questions that you would want to ask to the panelists, and I will take those up in that in a bit as well. But if you have any other questions, please leave them in the chat. Gesu, finally, so you worked at Microsoft and you worked on accessible technologies for visually impaired folks. What, in your opinion, do you think are some lessons that the government and the public sector could learn with regards to accessibility from the private sector?
That's kind of like mixed in a way that I think the very first thing the government needs to make sure that, I think private sector in many ways cannot really do that, is like providing like a basic infrastructure where tech can actually be used. So coming from Microsoft, where we were trying to design the apps and the games, but as I mentioned in my previous answer, that we cannot really do that unless we have, a smartphone per child, or at least like a computer in the school per child. Even when they are staying in the residential school, the residential arena, provided by the school, they don't have computer access. They're just like one, placeholder computer that's put there, and sometimes it's not even working. So government can do a lot here, like especially with national education policy, which comes up like, the very recent one, where they did highlight the point that, including play as part of the learning is important and it's encouraged. But there is very little bit of, spotlight that's been given to how disabled children can benefit from it. So in terms of policy, they could actually the government could actually incorporate like a lot of things that teachers themselves in the schools have been telling for years now, like to reduce the burden, hire more teachers, provide more training related to digital skills specifically for the teachers themselves, and so they can take it forward to the students after a point. And in terms of curriculum, like curriculum exists for so many years for integrated schools in general, but there is no accessible curriculum for computation thinking, for example. And with accessible, I don't only mean that you provide the text in braille or in accessible print, rather as somebody who is sighted, there's a lot that I can learn visually, and there's different colors, and there's a lot of interaction which happens visually for me. So as a blind child, there is a lot that can be done in tactile ways. So it's just not just providing something in print, rather also like creating games or things that children would actually engage in. So government really needs to go in the ground and find what actually the school administrators and the teachers themselves have been voicing for years now, and actually get on to do it. Yeah.
Thank you so much, Gesu, and thank you to everyone who's been with us till this point and for joining us today. This has been a very, very impactful conversation, and especially if we need to move on with emerging public tech infrastructures, and for e-governments to be able to fulfill the information and service needs of citizens, inclusivity, accessibility, and accountability will be key. With this, I would like to move on to any participant Q&A. I have a few questions that we've collected in the registration forms. I can begin with those, but in the meantime, it would be great if everyone can leave any questions that they have in the chat. I will give you a few moments to do that, but I will start with some questions that we have already. So someone has asked, how do we tackle digital inaccessibility of popular apps such as Practo, 1MG, etc., which are also popular digital healthcare apps, because those are also supposed to be inaccessible, and they may prevent blind or visually impaired folks from accessing them. So if anyone of you would like to take this up, please go ahead.
I can take that up. So I hope I'm audible.
Yes, you are.
Great. So this is an area that some of us have been working as a part of organizations. Now, usually what happens is that these are all, most of these are startups, and when they start a venture like this, they often account for persons with disability and accessibility need. Now by default, actually, if you look at legally, they are bound to RTWD Act does have some very important clause that mandates accessibility. So what can we do to make them accessible? Now there are multiple approaches. One is we are trying. One way that we approach this issue is to flag this to them. Now there are different ways in which these companies react. Some companies are kind of welcoming and appreciate these suggestions, and then try to incorporate that kind of accessibility in their development. Some companies just stonewall the request. They kind of respond to us, so we have to. So we often we go to social media and try and flag this to the world, so that at times that works. At times even that doesn't work. So that's when we go to disability commissioner, file a notice, get a notice from the disability commissioner, which the company has to respond. And it's a time stipulated response. So so we get some companies on board. So that's what we do sometimes. So what can others who are non-disabled or who would like to be part of this kind of programs help do is keep a watch out on your social media networks and see if there are any campaigns that are run by persons with disability or organizations to make these apps accessible. Recently, in the last 4 to 5 months, we're trying to do a lot of this activity. There are 40 to 50 odd apps, and some of them working in the healthcare sector. We are trying to do this accessible. We are trying to make them accessible. So watch out for these campaigns and amplify us. But if you are a developer, or if you are in any role professionally, in any of the company that you work, whether it be related to health sector or otherwise, walk up to your developer, or walk up to the concerned person and ask, is our app accessible for everyone? And more than often, inaccessibility comes from ignorance. More than often, inaccessibility comes from ignorance. More than often, inaccessibility comes from unawareness about the fact that actually people who are blind or visually impaired do use the apps. Many times the companies are unaware about the market potential and such that. So maybe a word at times, a minor nudge has also worked. Just to conclude, we employ different approaches because every company, every management, and every team is different. So we don't have a template to say this approach will work for one approach fit all kind of a template. We are also learning. We're also trying out. But yes, like the public sector apps being accessible, there is a lot of inaccessibility in the private sector as well, and that's a major issue that we are tackling right now. Thank you.
Thank you, Tony. There's a question from Madhulika. She says, recently there was a major breach of PHI data across mental health apps. A study done by Mozilla Research. How might we ensure there is design for privacy which is accessible for all? Srinidhi, perhaps, would you like to go?
I think one of the concerns with a lot of the privacy and security conversations we've been having is also around accessibility and sustainability. I remember early on when, and also about who is using these apps. Like there is a lot of conversation around moving off WhatsApp onto other safer applications, etc. And I think in part, some of this is around ease of usage for screen reader users and other disabled people. But it's also about awareness in the community around privacy, security, etc., which might not necessarily be there. So there is a skill building that's needed in terms of creating more conversation around it, so that there will be more resistance to using applications that might be not conducive to our privacy and our security, etc. I think that for me is the part around engaging with the community to respond to the others. The other really is around what Tony is saying is around larger conversations in our spaces around what does digital privacy mean, and what does that mean when it comes from communities whose privacy has been violated. So I think that it would be helpful to think about it both as skill building for the community to be able to speak up, and also for others to be able to understand, because there is, and this is something that Smitha raised, there is a lot of stigma around disabled people in general. So that is colors how how we talk about privacy, security, etc., with them, and about their own private medical information that could possibly be shared on these apps without their consent.
Thank you, Srinidhi. I understand that ideas of privacy by design can only take you so far, because privacy is like so hard to achieve in complex AI and data-driven systems. Will anyone else, does anyone else want to come in on this question?
I would like to reiterate what Srinidhi and Tony was saying. These kind of matters should be discussed publicly in different forums. We have to take it up in the media, because media reaches across board. And so we need to have repeated sessions in the media on creating awareness about the private spaces and privacy matters. And it should also be dealt in government forums like the State Advisory Board for Persons with Disabilities, under the State Commissioner for Persons with Disabilities, and at the Chief Commissioner's Office for Persons with Disabilities. So different forums should talk about this, including the Human Rights Commission as well. Thank you.
Thank you, Smitha and Srinidhi. I think both of you have highlighted how the collection of data is also a very hierarchical approach. Generally, the data is generally collected from from people who have not been in power, and collected by people who have held those positions of power for the longest time. I don't think there are any other questions. I don't see them. If anyone has any other questions, we can perhaps wait like a couple more seconds. But yeah, I think we can conclude. We're also nearing time. I would like to thank all of our panelists, and actually I would like to invite Sasha to do this a bit more formally.
Sure.
Thank you.
I can do that. Hi everyone, I'm Sasha, Communications Manager, Digital Futures Lab. Just want to take this moment to thank everyone attending that's turned out. This was quite the lively discussion, and a lot of conversation around design around technology that we don't take seriously enough outside of these communities of people with disabilities. So it's given us a lot of discussion, food for thought, and that's always good to be left with questions to chew on than not. I'd like to take this moment to thank our panelists, Tony, Srinidhi, Gesu, and Smitha, for agreeing to be a part of this Tech and Society Dialogues event, for sharing about the event, of course, and finally leading such an important discussion. We sincerely appreciate your time and your willingness to share your knowledge with us, and your lived experiences as well. So thank you. I'd also like to take this moment to thank our partner, the Omidyar Network India, for supporting the Responsibility Technology Initiative, under which the Tech and Society Dialogue series is housed. We're able to do these monthly series and much more because of our partnership with them. And so a little shout out to them, I guess. And lastly, to all of our attendees, thank you for taking the time on a Wednesday at the end of a working day to be here with us and to add to this conversation. We hope that you enjoyed this event and will come back for more. For all of you still